And so on February 5th of 2002, my parents decided they would take me to the Menninger Clinic. It was 2 days after my 15th birthday, and I was at my parents' house. They told me I had an orthodontist appointment, and so that I needed to come home for that. And so I came home. I was sleeping in my sister's bed. All the other bedrooms in my house were contaminated. And I woke up that morning, and my sister was home. And I thought, well, this is interesting. Laura, why aren't you at school today? And so her response was, oh, I decided to skip. Well, if you know my sister, that made sense. So it wasn't anything super out of the ordinary. So I was kind of like, okay, that's fine. And then we went downstairs, I'll never forget, and my mom had made quiche. Now, my mom doesn't cook. She's never home. And so, at that point, you're like, something is definitely happening. And then I looked at the breakfast table, and my dad was sitting there at the table, and so I knew there was a problem. This is not normal. And so immediately I knew something was going on. I didn't know what, and I sat down at the table, and my sister was already pretty distraught, and she knew obviously what was happening, and so my parents explained to me that I was going to the Menninger Clinic. I knew what Menninger was. We had talked about it. I had done the assessment with the psychiatrist here in Houston. But what I also knew was that Menninger was a mental health hospital. What I also knew was that I had been told for years and years that I should accept the fact that I'll be in a mental health hospital for the rest of my life. And so although I knew they supposedly specialized and treated OCD, I also only knew what I had been told, and I only knew what history had told me, which is that people can't help me. I can't get better. It doesn't matter how hard I work, I seem to just be getting worse. And so I was scared and resistant, and told them that I wasn't going to go to Menninger, and they told me that I in fact was, and so I decided to try to run away. Now, I don't understand this to this day. I'm still trying to process it because, there was cars. I could have taken a car key, but I decided to go by foot. I'm not really sure where I thought I was going to get, but, it seemed logical at the time. My parents have made a lot of good decisions in my care. This day, they made some pretty bad decisions. They had a Navy SEAL, actually Congressional Medal of Honor recipient. I went to dinner with him this week, that used to work for one of our companies outside my house to literally tackle me and take me to the Menninger Clinic. They had packed all of my bags and had everything ready to go, which was fine. I wouldn't have been able to pack clothes at the time, so that made sense. But the way they did it, they certainly regret the rest of their life. We all make choices that aren't good ones, and we can all look back and say, we should have done this, we should have done that. And so that is a day that they certainly know the trauma and what happened. Probably a lot of it could have been avoided still going to Menninger. And so we got in the car, and Mike Thornton, the Navy SEAL, was getting in with us, and I made the promise to them that I would go if he didn't come. I wanted to be with my family and wanted it to be a personal experience. And so they agreed, and we drove to the airport and got on the plane and flew to Topeka, Kansas. And we landed that day in snowy Topeka. If you've ever been to Topeka, it is just not the most riveting city in the United States, nor is the weather something to write home about. So it was pretty dreary, pretty miserable on top of a day that was not looking so good to begin with. And we got out of the car, and at the time, I was a really petite kid. I had just quit gymnastics a year or two before. My sister has always been much taller than me. She's 5'11". Always was just a much taller person. At the time, I had very little clothes, if any, that I could wear. Most of them had something wrong with them. So I would look at colors on clothes as correlation to something bad. And at the time, I think I had like one pair of jeans and one tan Gap shirt that I could wear. So my mom bought multiple of those, but for some reason, those were contaminated. And so I showed up at the Menninger Clinic in my sister's gray sweatpants, which were about 10 times too big, and her Doc Marten boots. This is back when Doc Martens were cool. Maybe they're making a comeback, I don't know. And the laces in the Doc Martens were green, but they had a different color, like maybe brown on them. And so I took the shoelaces out because I thought they had bad colors. And so I'm wearing these huge sweatpants, these Doc Marten shoes that legitimately I wore a size like 6. My sister wore an 11 in shoes, so that it looked like clown shoes on me with no laces in them. And I'm absolutely distraught. And again, when you looked at me, you knew something was wrong. You didn't know what, you didn't know, no one understood or could be in my mind to hear or have the thoughts that I had, but you could tell physically that something wasn't right. And so we got to Menninger and admissions, and I was pretty angry, and we signed myself in, and we got upstairs to the OCD program. And we walked in the door, and I'll never forget, my parents, I think, were imagining, treatment is not cheap. It's very expensive. We'll talk about that in a little bit, but I think my parents were maybe expecting like a Four Seasons. I don't know what they were thinking. And so they walk in, and my parents don't even like travel or do luxurious things, but they walk in, and I'll never forget, my mom walks in, they look around, they see a gentleman who has no shirt on. He's standing behind the counter, so he looks totally naked. And he's lifting up his tray and seeing foil, which was a big trigger for him, and jumping about 15 feet back every time to eat his food. And I will never forget, my mom and dad walk very politely and nicely up to the counter, and they were like, "I'm sorry, they've sent us to the wrong unit. We're looking for the OCD program." This is it. So here you are. So they were pretty scared. What have we done? Where are we taking our child? What's happening? And little did they know, when they learned more about that patient and other patients, it was classic OCD, and they could totally see how I could get to that point. Certain individuals at the program hadn't showered for 2 years before they arrived at Menninger. And that seems totally crazy and something that we can't understand. But when you looked at how quickly my illness had progressed in just 3 years, my parents could see how without treatment I could be there. And so we sat in the therapy room, and it was an all-glass room, and I remember my mom, my sister, my dad, and I were there. My brother was at college. He didn't go with us to Menninger that day. And I was crying and begging and pleading. And I remember looking at them and saying, "I promise I'll try harder. I promise if you take me home and give me a chance, I'll wear those shirts I haven't been wearing. I'll even blow dry and straighten my hair. Like, I'll get ready for the day. I'll do it in a normal way. I promise you just need to give me another chance." The irony of me apologizing for an illness I would do anything to get rid of is pretty confusing. My dad and my sister were easily persuaded to being on my team. And slowly they were saying, "Linda," which is my mom, "let's take her home. We can't leave her here. We can't do this to her." And my mom, which I thank God for, had the strength to say, "We have to give this a chance. She can't try any harder. She can't work anymore. She's been doing that. We've been doing everything we can, and it's not working. We have to take a risk that is scary, but that's a risk that might give her a chance at life again, which is a chance that every child deserves." And so my mom turned to me and made a promise and said that she promised as soon as I was well, I would get to come home. You see, I was convinced that this is the prophecy the physicians had told me for years, which was that I would be in a mental hospital the rest of my life. And I figured this was just simply day one. And the thing is that my mom, when she made deals, they were valid and they were true. And I knew that she wasn't making or saying a promise she wouldn't keep. But the issue is that you get to come home when you're well. I didn't believe or think being well was a possibility. For years, when you go to therapists and professionals who are supposed to be good at what they do, and they can't help you, why would you think this is going to be any different? And my dad tried to convince my therapist, Dr. Bjorgensen, that I should get to come home that day. And I remember he looked at my dad and said, if your daughter was addicted to heroin, would you leave her? And my dad had an older brother who was an addict who who battled with addiction, who they spent a lot of years trying to get sober. And my dad was able to relate and understand the analogy, but his quick response was, this isn't the same, you can't compare the two. And Dr. Bjorgensen looked at him and said, it is no different. She has no more control over her life right now and the decisions that she makes than someone with an addiction. You have to leave her here. You have to give it a chance. And so my parents left me that day at Menninger, and I've never experienced that sort of anxiety, fear, loneliness, and acceptance at the same time of a disease. You see, I started to finally learn that day that although I was sick and although I had OCD, I had to slowly accept my illness. I think I spent years and years trying to get rid of it and pretend it wasn't there and say why and not want to have to deal with it. But I was at a place now where it was in my face. This was my life. This is what had taken away my childhood. This is my only chance. And I was vomiting and physically ill from the anxiety and stress that day. And I sat down on the couch at Menninger, and there was a young redhead girl named Amy, same age as me, sitting next to me on the couch. And she looked at me and said a few simple words. All Amy said was, "It's okay, I cried too." She didn't talk about her illness. She didn't talk about her OCD. She also has an eating disorder. She didn't talk about that. She just said, "It's okay, I cried too." Those few words I'll never forget because it was the first time in my life I felt like I was sitting next to someone who could understand me, who could relate. She was my age. She was a young, driven girl, but her illness had also robbed her of her childhood. And so we created a relationship that we still have to this day, and it's been an amazing, remarkable journey to get to know and have somebody who can relate to you on a level that nobody else can. You see, it doesn't matter how much my mom, my sister understand and know and are a part of my disease, they don't live with it. They don't have intrusive thoughts. They don't have to fight the illness, and so they don't fully understand what it's like. Now, I think they're pretty close to understanding. They're the closest I could say most people are because they've had that lived experience, but it's not in their mind. And so I sat down with Dr. Bjorgensen and started to do my formal assessment, and I lied on every question thinking that if I don't say the truth, then I probably won't have the illness and he'll let me go home. Again, probably not the best idea, but more importantly, when you're with someone who actually knows what they're doing, they can see past a lot of that. And so pretty quickly, even though I lied, I got a 38 out of 40 on the Y box, so I guess that didn't work out too well for me. And he knew that I had made up most of this because he had already done family assessments. And for the first time, he asked questions that made sense. He asked me things about my deep-rooted fears, about the unwanted intrusive thoughts, specific questions about rituals. He talked to me about what therapy would look like and the fact that he had worked with people more severe than me. That he knew I could have a chance at life and that I could, in fact, regain what my OCD had taken away from me, but that simultaneously it was going to take hard work. So I made a deal with him that I would give it my all and I would engage if that meant every 2 weeks we could reassess to see if I could go home. And so my deal with him was that in 2 weeks, if I'm at this level, I get to go home. And so he made the deal knowing that I wouldn't be at that level in 2 weeks, but that if I worked hard and I saw progress, I would probably keep it up. And so I did. I dove headfirst into treatment. I was finally engaged in treatment that works. Treatment for OCD is called exposure with response prevention. It is a specific form of CBT treatment. It is the only effective treatment known for OCD across the board. It's what we recommend for all individuals as a first-line therapeutic intervention. And so what does ERP mean? It means that slowly and systematically I'm going to be faced with these things that scare me so much, and I'm going to have to resist ritualizing. It's different than exposure therapy alone, because exposure therapy, we will confront people with their fears. They don't have rituals, so we're not having to worry about if they're compulsing. With OCD, we have to stop the rituals also. If you're having me touch things that are scary to me, but I'm washing my hands, it's not going to work, right? But I need to remove the hand washing as well. And so I dove headfirst into treatment. I was motivated and I was engaged, but I didn't go home in 2 weeks. 90 days later, I was being discharged from the Menninger Clinic. This day was equally as hard as the day I arrived. I probably cried just as hard. I was just as anxious for many reasons. I was leaving a place that had become my home. I was leaving people who had become my family. But more importantly, this place gave me a chance at life again. To go from a kid who wishes every day that they weren't alive, to being able to return back to Houston and imagining going back to the high school I had been avoiding for years. Thinking about the fact that maybe high school graduation was, in fact, in the cards for me. We had been told so many times that it wasn't and that we should give up on that. And so little things like that were huge goals. But you see, like graduating high school and going back to my school and doing these things that seemed so hard were not the little victories that I was most excited about. The things I was most excited about were the fact that when I left Menninger, I could take a 5 to 10 minute shower. I could dress myself for the first time in years. I could wear whatever I wanted out of my closet without thinking about it and worrying about it. And I could engage in friendships and relationships the way that I used to. OCD certainly robbed my childhood, but this was the first glimpse I saw that it didn't have to rob my life.